Joy Johns works at a Genesee County medical office.
Thank you for calling Hamilton Spinal Care. This is Joy. How may I help you?
Sounds crazy, but Johns didn't have health insurance until this past December.
It is quite expensive, and I just was never employed with an employer that carried insurance.
That meant avoiding the doctor's office at all costs.
If I got a cold, it would have to be like I could not move out of bed, miserably sick before I would go to the doctor.
But a family member told Johns about the Affordable Health Care Act open enrollment period. Johns reached out to the Genesee Health Plan to weigh her options. Now you have health insurance.
Yes, I do have health insurance.
What do you have now?
I have Blue Care Network, and it's been wonderful.
A lot of people come in and they're uninformed and they don't know, and sometimes people wait too long and they're ill and they need help right away.
Genesee Health Plan enrollment specialists say there's a lot of confusion about who can apply for what. The first open enrollment period for the Affordable Health Care Act had a lot of issues.
The system was down most of the time, and there were a lot of computer glitches. A lot of people were interested in enrolling.
But still, nearly 7 million people enrolled in the healthcare exchange nationwide in 2014.
There's really little reason for someone not to have insurance, or at least certainly not to have looked into what possible coverages there are, because there's a lot of affordable to no-cost options for them now.
Joy is now covered for checkups, emergency room visits, and even x-rays.
I am fairly healthy, so I don't really have to worry about monthly prescriptions or anything like that. But if I did, I know I would be covered.
If you don't qualify for the healthcare exchange, there are other options, including Healthy Michigan, which is just a fancy term for Medicaid expansion. You have to be a single person making less than $16,000 a year for that plan. There's also the Genesee, Saginaw, and Bay Health plans. You have to be a single person making less than $20,000 a year for those plans.
Sometimes people do come in and they have immediate needs. They're diabetic, they have high blood pressure. As long as they meet all the qualifications, Genesee Health, we're able to, in most cases, get them what they need within 24 to 48 hours.
For Johns, her need wasn't immediate, but now she has peace of mind for the future.
So now I can actually go to the doctor, get it taken care of without missing work, and I feel a lot better about it.
In Genesee County, Walter Smith-Randolph, NBC 25 News.